Tonight, we are getting a clearer picture of Georgia's COVID-19 vaccine plan.
The governor is saying the drug will be available for vulnerable groups first in a matter of days.
This long nationwide nightmare will end. The vaccine is on its way. Therapeutics,
as we deal with our worst surge ever, Georgia now averaging nearly 4,000 infections per day.
CBS 46's Haley Mason is live tonight at the state capitol. And Haley, you've been digging through the governor's plan. How does it all shake out?
Tracy, well, this plan just published this week is giving a lot more detail about exactly who will get those very first doses of the new COVID vaccines that are expected to come out in the next week. The state has released this new 63-page official COVID-19 vaccination plan, a detailed update spelling out how people will get the vaccine when it's approved in the coming days.
The limited amount of vaccine doses we will receive in the coming days will be going to the most vulnerable and those on the front lines of fighting COVID-19. That means residents of nursing homes and our healthcare workers.
State leaders say there will possibly be several 100,000 doses initially, a limited batch reserved for long-term care patients and their healthcare teams. The plan says Georgia health officials will decide the amount of vaccine given to each of the 18 public health districts and enrolled COVID-19 providers based on population density, the level of disease endemic to each area, and the number of priority populations. Only certain licensed health professionals can administer it, including physicians, pharmacists, nurses, physician's assistants, paramedics, and medical students or residents.
The general public will not be able to be vaccinated for months.
Also in line to get the vaccine with the most critical groups are hospitals, public health clinics, and staff in clinical settings. The next tier, called Phase 1B, will include police and fire, critical personnel like pharmacy staff and educators, court, grocery, and transportation workers, and people over 65 with comorbidities. And long-term care facilities have multiple options on how to get these frozen vaccines into their buildings. The good news is more than 95% of them have already enrolled in the program to get the vaccines to their patients and workers. If you want to know how your group fares in this whole distribution plan, you can check out a link on our website. We'll put this entire plan in its entirety on our CBS 46 website and app. Reporting live outside the state capitol, Haley Mason, CBS 46 News.